What about these fancy new medications that are supposed to help addicted people? Ah, yes, medication assisted treatment, MAT, is all the rage in the addiction treatment industry. What is MAT? Well, in theory, it's the idea that you can help people get sober through using medications, drugs, and by continuously keeping them on these medications, again, drugs, they won't go back on, wait for it, drugs. I'm not intentionally bashing MAT. There are definitely times when medication is absolutely appropriate in treating addiction. I'm bashing the way it is promoted as a solution rather than a temporary tool. You know what else was sold as a solution to pain? OxyContin. When it first came out, all the pharmaceutical reps assured doctors that it was not addictive. We all know how that turned out, as it is basically the drug that started the opioid epidemic worldwide. To me, there is a massive conflict of interest with MAT because it's really profitable to Big Pharma to keep people on as many medications as they can for as long as possible. I'm not opposed to it as long as it is properly understood as a tool to help save lives from overdoses or to reduce severe cravings and discomforts while coming off heavy drugs and alcohol. But it is not therapy in itself. MAT may reduce cravings chemically, but it does not address the causes of these cravings or addiction-related issues. It's more of a band-aid for an open wound than a cure. Once the wound is healed, why still wear the band-aid? I can understand the attempts to keep addicted people medicated so that they don't die. Truthfully, if one of my kids was taking heroin or fentanyl and was unable to stay clean, and were out in the streets trying to score drugs every night, I would absolutely rather have them taking a medication like Suboxone or Methadone and trying to stay alive rather than overdosing and dying from something they bought on the street. Of course I would, and I think most parents would feel the same way. Crucify me all you want, anti-medication purists. I'd admittedly rather have my kid medicated and alive than dead. There are many people out there who are alive today because these meds kept them from overdosing. It stabilized them long enough to get momentum in recovery, so there are absolutely practical uses to it.